Welcome, everyone. This is the Let's Keep Talking series for parents and caregivers. Today, we're going to talk about community resources for youth, especially around mental health and substance use. The Let's Keep Talking series is sponsored by the School District of Marshfield, Everett Rail, Marshfield Public Library, and MACY, which stands for Marshfield Area Coalition for Youth. So we appreciate you being here. We've run the series all school year. We'll take the summer off, and we will pick up again in the fall to do some similar and some different topics. So please keep an eye out for those things. Today we're going to do a bit of a panel. So there are multiple of us who are speaking, and we're going to take turns talking, and then we'll have a chance to answer questions, if that's okay. Okay, perfect. So we're going to talk about community resources. I'm Joanne Greenlee. I'm the mental health navigator for the School District of Marshfield. I am a school social worker by training, and also I have been a mental health clinician as well. I still have my LCSW. So we work a lot in the student services department of the school district on resources. And so I'm going to go over some of the ways that we can do different things. So here's our panel: myself, Georgette Teschner, Heidi Hoffman, and Liz Gussie, and I'll introduce them when it's sort of their time to come up. There's copies of this presentation in the back. If you are interested, you can certainly take one and follow along if you would like. We're going to start with resources through the School District of Marshfield. Because we are primarily focusing on resources for youth, it makes sense to start with the school district because that is where youth spend a good part of their lives in our schools with the adults that are in our schools. So they have a unique opportunity to gain some resources and be able to get support through the school that they attend. I'm going to talk specifically about the School District of Marshfield, but there will be mirrored services in any public school that somebody might have. And so you could follow a similar kinds of things with other school districts. So don't be put off by the fact that I'm saying the School District of Marshfield. If you go to Stratford or Spencer or those kinds of schools, Pittsville, they all have these similar kind of services.
Does Columbus have something?
Columbus has some things, not quite as much, but they definitely have school counselors that can help out. Okay. I did first talk about in most schools and certainly in the School District of Marshfield, there's some universal things that help kids with mental health. And those are sort of all school staff work on building relationships with students. There's lots of training that goes on within the school, and in particular, the School District of Marshfield does some trauma-informed services, as well as QPR, which is a suicide prevention training. We train all of our staff, even cafeteria workers, in QPR. So, and we also train students during their health class in QPR. So we use that as a universal sort of gatekeeper to help us monitor how kids are doing with some mental health. There's also prescribed curriculum that the school has. There's mental health and substance use prevention curriculum, primarily pushed out through K through 6th grade guidance classes, which is administered through our school counselors, and through the health curriculum, which is administered at the middle school and high school through our health teachers, and at the elementary level through regular education teachers. If you're interested in what those curriculums are, they're on the district websites. And so you can sort of see what some of those standards are and one of those objectives are that we're teaching at all of those different levels. There's also a couple additional times where kids get some lessons at the middle school. There's a short 20-minute class called Learn Class. And we do some social emotional learning during that period, as well as, academic and career planning and expectations at school and all of those good kinds of things we do. And at the high school, we have what's called Tiger Time, which is monthly or twice a month periods of time in the middle of the day where those same kinds of lessons get pushed out to all students. Okay. Student services, it's a great first place to start. So what I mean by student services are the people who are listed here. There are school counselors. So all of the buildings at the school district of Marshfield have school counselors in them. In fact, all of them have full-time school counselors, so somebody that's there every day of the week. At the high school, there's 4 school counselors. Middle school, there's 1 school counselor and a school social worker. At all the elementaries, there's a full-time school counselor that's there 5 days a week. And they are the primary and first contacts for students having to do with both academic and emotional needs. We also have school psychologists in each building. They primarily, in the school district of Marshfield, work related to special education. But they also do a lot of support having to do with behavior issues in our schools, and sometimes some of the emotional supports as well. We have some school social workers. I'm one of them, but I work as the mental health navigator. We have a middle school social worker and a high school social worker. I put that's where we have them. This year we have an elementary school social worker, but she's retiring. So we'll be having social workers at the middle school and high school level. They primarily do that sort of extra help when there's more things needed than what the counselors can deal with. So sometimes that's social emotional support. Most of the time it is helping students and families get resources and connect them with the things that they need within the community. And that's what when somebody needs extra help doing that, the social workers will get involved with that. And then we have school nurses. We have 2 district nurses, but we have health aides in all of our buildings. They primarily deal with immediate medical needs within the building. If at an elementary level someone falls and scrapes their knees, they're the ones who are helping out, along with probably secretarial staff and other people in the main offices. But they also help with distributing medication at school, and coordinating with primary care physicians if there's greater medical needs in our buildings. The nurses also do health alerts. So if somebody has allergies or some other medical condition that the entire school or their teachers need, then that gets pushed out so that they know those. So that's your student services staff right there. So when I talk about the student services staff being the helper people in our school buildings, these are the people that I'm talking about. Okay, boy, that's off a little bit, but that's okay. How a student may get help at school. Primarily, people get help at school because they're referred by somebody. And the referrals can come any way. It could be a self-referral. A student comes into the counseling office and says, I need help with my relationships, with how I'm feeling today, whatever that may be. It could be a parent calls and says, I'm really concerned about Susie or Joey or whatever. It could be a teacher is noticing something in the classroom, whether it's because of their QPR training or because they're starting to fail academically or they just seem off. A teacher may come to a counselor, or they may talk to the student and then bring the student to the counselor to be able to get some help. Sometimes principals get involved. That's primarily if there's trouble. So if there's some trouble, we don't want to necessarily look at it as just trouble, but also looking at what's behind it and what's going on. And so the student services staff might get involved because of that as well. And then we monitor attendance and academic issues and sometimes call kids down to meet with them or talk to their parents because of those other issues that may lead us to look at mental health or substance use issues as well. Special education and 504s, those are more formal processes that happen that sometimes address mental health. For special education, there are formal evaluation processes for students who are considered, it's called EBD, emotional behavioral disability, as well as there's a classification called OHI, other health impaired. So if there's some health issue, and mental health is health, if there's something that is documented that may be getting in the way of education, they may qualify for some of these services. It is a process, not an automatic. So there's a full evaluation that happens with any of those kinds of things. A 504 is essentially they qualify for special education, but don't need as intensive services. So they may get other accommodations within the school building that could be more time on tests in a separate setting, things read out loud to them, any number of other accommodations that might be helpful for them. Special education and 504 are not common, so those aren't normal things that happen, but those are special things that happen. And then another way that kids might get some additional help related, especially to substance use, but also to mental health, is if they get put into a diversion program. So if a student gets in trouble at school, say for vaping, they get caught with a vape, they're going to, when there's a first offense with substance use, we try to use what we call a diversion program, which is an educational and support program that we provide for the student that sort of keeps them out of the juvenile justice system. So we'll say, we're not going to make a referral to juvenile court or to Judge Cruz. We're going to give you this program. And if you do this program, that's sort of your first strike. And you get a free pass for this one because we're trying to give you help and then hopefully keep them out of more formal systems, so to speak. Those programs are educational. There's also some intervention. So our counselors are trained in motivational interviewing, which is working with students to do problem solving and motivation to change behavior. And so some of those things might happen as well. We also have what's called the Marshfield School-Based Mental Health Consortia. That's actually what my job is to coordinate that program. We have gotten community therapists that we have agreements with that come into our schools to provide mental health therapy for students in the school setting. We have it primarily set up, and not all schools have this. Many of our schools have some therapists coming in, but not as formal of a program as we have. We have set up our program so that it addresses any barriers to service. So if a family can go get mental health treatment in the community, we let them do that. If they have barriers, like they work a job where they can't get off during business hours when a therapist is available, if they don't have transportation to get them to and from appointments, if financially they may not be able to afford therapy, if the kids missed a lot of school and being away from school for a half day or a full day for a mental health appointment is going to be harmful, then we look at, could we do it in school? And so we have Children's of Wisconsin, Marriage and Family, Absolute Impact, and Red Maple Therapy who are coming into our schools to provide therapy for students at our schools. I put down sort of like what happens. We sort of assess need. Is there really a barrier? Is this something that's needed? Is everybody on board? We really like the kids to be on board. It's not just if the family says or a teacher says, parents and kids have to be on board, otherwise the therapy won't work. We get consent from the parents to do a direct referral to one of our agencies. Then the agency sort of takes over and does all of its regular paperwork, all of its regular consents. They do a release of information so that we can collaborate within the school system so that we can all be on the same page helping the student. And the agencies bill directly. We don't deal with any money at the school district. It's a direct bill like you would if you went to see them outpatient. And the appointments are set at school then. And we provide the space and anything the therapist might need to be able to do that and coordinate with them so that kids are not missing too much academic work. We have also gotten some money from United Way. And some from the Community Foundation and from General Motors, so different grants to, so families can apply. If they cannot afford therapy, we can provide some financial assistance. That happens mainly with families who are underinsured, that's what I would call them, or not insured. If they're on Badger Care, it's pretty easy to get them mental health treatment. Most places take Badger Care, but if they have an insurance and still have a really high deductible, lots of families will not get mental health treatment because it costs so much. And so we can pay for some of that therapy if the family would like us to. And that has been very helpful. Okay, those are the basic things about how somebody is going to get services at school. I've also in the back have some resource sheets that the school district provides to families. They're also on our website so families can have them. So our counselors frequently give out those sheets to families, as well as sometimes we'll help a family connect directly with somebody. And certainly our counselors know about our school-based mental health. I will say, and we're going to talk about this later, it's harder to get substance use counseling in Marshfield for youth. There's just not very many services. So that's a gap in services that we have. We'll talk a little bit more about that one towards the end. There are some different things that we can do having to do with that. So those are how you get services at the school district. And now we're going to talk about how services happen through the county. I'll let you ladies introduce yourself.
Hi, I am Georgette Teschner. I am Wood County Comprehensive Community Services, so CCS.
And my name is Heidi Hoffman. I also work in the same department. I recently switched to that department. I do have a background in crisis intervention as well.
Do we just move it over?
Yeah, just move it.
Okay. So the first thing that we'll kind of just talk about is a general overview of behavioral health therapy services. So our Wood County Outpatient Clinic, we have locations in Wisconsin Rapids, but we also have a location here in Marshfield. I think what's important to sort of note is that the location here in Marshfield, there is like usually only one or two therapists sort of available. The other one does telehealth, so she'll meet with clients via telehealth in Marshfield. But they do provide counseling services, psychiatry services, group therapy, mental health case management, so that's what the outpatient clinic does. And then we also have Norwood, and that is adults only. So Norwood provides that acute psychiatric care.
And the county does have substance use services as well. Their counselors have dual certification, so you can get substance use. It's just hard to get into.
Yeah, and it's for
And it's
adults.
for adults. The substance.
They'll do young kids too. I've had them do some young kids for us as well, but it's very rare to be able to get them in because I think there's only one person that provides it, and sometimes it's down in Wisconsin Rapids.
Yeah. Okay. Do you?
So Norwood Health Center is there's actually several things inside that building. Probably the most prominent for the mental health piece is the hospital unit, which does acute hospitalization. So that would be short-term stays for mental health. Many times that's due to suicidality, such as that. There's also a couple of other options in that building. There's Bridgeway. That is a short-term crisis stabilization unit for adults only. That would be for someone that's maybe experiencing more of those types of symptoms, has more resources in the community, maybe doesn't need quite that high level of care, but isn't necessarily safe in the community on their own due to lack of support. One more thing. If anyone needs either one of those facilities, that is all coordinated through crisis intervention. And that number is both on the slide and on the pamphlets in the back.
So next we'll just kind of talk about, so on the last slide, it referred to the mental health case management services. So there's a couple programs in Wood County that provide sort of voluntary mental health case management services. As this slide sort of makes reference to, as that if you were making a referral, you don't necessarily need to know which program you want to refer to, just that maybe you have someone in your life or maybe yourself is looking just for some extra support with mental health and or substance use disorders. And the programs themselves will sort of sort out which program will be best for that person or youth. Anything else? Mm-mm. Okay. So first we'll talk about CST. So CST is a wraparound program. It works with kiddos, and so CST is unique in the way that most of all the other services we'll talk about, you have to be involved in Medicaid or Medicare services. And so CST is one of the programs that you don't need to have Medicaid for. They can provide some. So what I mean by wraparound is that they work with youth in a way that is sort of a team approach. So they work with kiddos like by pulling in all the service providers that sort of work with them, and then coordinate services in a way that is building a goal around the child. The child sort of gets to drive the bus, is what I've always said, and they get to sort of pick like what are the goals or what are the things that I want to work on. So that may be different or feel different for a parent, but it's really sort of youth driven and then team based. Anything else that you can think of?
Not on CST.
Okay.
Okay. CCS, which is Comprehensive Community Services, is another one of the programs that the county has. This is a Medicaid funded program, so you have to have Medicaid. Pretty much the bottom line criteria for that program is being qualified for that medical assistance, as well as being diagnosed with either a mental health and or a substance use disorder. It is for the whole lifespan, so children all the way through. Older adults are eligible for this program. It ultimately coordinates support and resources to help the consumer meet their goals. This is another program that is very client driven. The client, whether they be adult or child, chooses those goals that they're going to work on towards their mental health. And then it seems like some of these programs, the description's pretty vague. And that is really because it's tailored to the person and what those persons need. Okay.
And then the next program, I'll just give a brief overview. So I've not ever specifically worked in this program, only ever made referrals. So I don't know like all the ins and outs of CLTS, but I know enough about it to share a little bit. So the waiver program is often what we refer to it as, or CLTS, Children's Long-Term Support Waiver Program, is for children who have been diagnosed with a physical, cognitive, or emotional disability. Mental health is included in that. And so it really is like sort of a payment source. So it helps pay for extra supplies or things that Medicaid doesn't typically pay for. So oftentimes people will use the service for respite. They can get respite services. We have a limited providers in the county that provide respite for these kiddos in CLTS. However, there are options out there for this kind of service. Again, I think just making sure that everybody understands that is a Medicaid service. And a child has to be on Medicaid, whether that's through, and that includes also Katie Beckett. So if you don't know what Katie Beckett is too, I'd recommend just Googling Katie Beckett because it is also, oh, perfect. You're going to talk about it. Super. Okay. So that's another way sort of to get on Medicaid. If you have a kiddo who needs sort of some of these supports, that is not income based. So Joanne said we'll talk about that soon.
CCS is another one that Katie Beckett qualifies you for.
Mm-hmm.
Can I ask a question about these?
Absolutely.
Are all of these voluntary, meaning a kid or a student, if we're talking about a youth or an adult even, that they have to volunteer to do this and it can't be somebody who forces them to do this?
Correct. So that even means that if mom and dad really want kiddo in one of these programs, if they look at us and say, no, I'm not doing it, that's the end of it. We won't go any further with that. However, we will take referrals at any point in time. So if that child later changes their mind, by all means, put in another referral.
And I would say too, we do an active effort and do sort of some motivational interviewing to try to get kiddos to engage with us. So it's not like the kiddos like, no, and we're just completely done. We do a lot of sort of motivational interviewing and try to get the kids engaged in the services because we often see the benefits if kids are willing to work with us. So and the long-term benefits of kids being involved in these programs. So yeah. CLTS is a little bit different because that is sort of like a parent-driven program. Mm-hmm. It's really more or less just providing sort of, like through CCS, we're providing more emotional health sort of services, where CLTS is providing sort of those tangible things like fidget seats or like shower adaptive sort of things, those kind of things. So that's kind of the difference. Does that help? Okay. All right. This is Liz's turn. Yeah. So
My name is Liz Gussie, and I've worked as a casual for Wood County Crisis for about 18 months. And I've also worked in juvenile justice ministries for the last 12 years. And so we'll kind of talk about both of those here. But nationally and locally, there are a variety of different crisis lines. One kind of misconception that I think a lot of people have is, and I've been a QPR presenter for the last like 5 or 6 years as well. So got to know sort of suicide prevention that way, and then dove into crisis about 18 months ago. But one kind of misconception that I think we have a lot of the time is if someone admits that they're suicidal, that they're automatically going to get locked up right away, or that their freedom is going to be taken away. When in reality, there are a variety of different resources out there to walk alongside someone when they're not feeling the greatest, when their mental health is, not where they want it to be, and provide, support in a way that doesn't restrict their freedom. So these are a variety of different crisis lines. 988 is a national line. I should have brought some stickers. I have some great like window cling stickers for those that Prevent Suicide Portage County has put together. But 988 is around the country. We've got Wood County. The Hope line is fantastic. I met the woman who created that a few months ago, along with the Trevor line. 988, here's a little bit more details on it. It's 3-digit dial code, just like 911. So you just call those 3 numbers and you get directly to a suicide prevention line. And they're trained crisis counselors. At times, if it warrants it, they can refer to a local crisis line so that we can connect with the person on a local level, and direct them from there. So our crisis intervention line, we can be a listening ear. If someone's just struggling and needs 10, 15 minutes just to talk and vent stuff out, like we're happy to listen. Sometimes when we pick up the phone, we don't necessarily know what kind of call we're going to get. Maybe it will start out as supportive listening, and then we realize that there's something more serious going on. But we can assist with problem solving. A lot of times we'll ask like, hey, what kind of coping skills have you used so far? Have you tried this? We can also assess for the need for a variety of different levels of care. If it gets to the point where it's very clear that a person is a threat to themselves or others, we can work towards having a mental health detention, meaning law enforcement will transport them to a hospital of some sort. And we can also initiate a mobile crisis personnel. So at times, we're taking these phone calls. We have a hard time understanding exactly what's going on because we're just hearing the voice, right? So if we have on-call crisis workers to actually go out to the location where the person is and to assess the situation from there. Considerations for youth with crisis workers can talk to youth without parent permission. Any kid can call the crisis number and say, hey, I'm not feeling so great right now. Like, this is what I'm struggling with. Crisis workers want to and will work with parents for the most part, unless it's not in the interest of the child. Safety planning with youth and family is a priority. A lot of times when we're talking to a youth, we'll also end up talking to a parent too, because we need to know if we keep this person at home, that there is someone to supervise them, that there's someone to monitor them, and so on and so forth. And crisis is focused on safety and preventing hospitalization. So like I said before, just because someone mentions that they're suicidal doesn't necessarily mean that they are automatically going to be hospitalized. That's a last resort when it comes to a lot of these situations. We want people to stay in the environment that they're in if that's what's healthy for them, if that's what's safe for them.
Can I add?
Oh, yeah, absolutely.
So one thing, she mentioned that crisis workers can talk to children without parents. That is true. However, when it comes to getting a child into services within, whether it be a voluntary hospitalization, crisis stabilization units, which there's one in Wausau, that's really the only one in the area. Any of those types of situations, we do need a guardian, whatever that looks like for that child. to sign them in. And that includes safety planning. We have to have parent and guardian involved in some way, shape, or form. It doesn't have to be, it can be flexible somewhat due to the child's needs. But as far as supportive listening, that type of thing,
Yep.
they can call.
Yeah, so anything beyond supportive listening, we do need parent involvement in. And also when it does come to hospitalization, both youth and adults need to have medical clearance first. So if we are working through a situation where it's very clear that someone needs to be hospitalized, it's very clear that they're a danger to themselves, they're a danger to others, we will ask that person to go to the emergency room to get medically cleared, to get checked out before we're able to take them on to the next step of going on to a hospitalization from there.
Liz, can you speak to why what they're looking for in a medical clearance?
We need to know, I mean, just basically that they're healthy, but we also want to know, we want to understand like their labs, you know, is this person under the influence of something? If this person is highly intoxicated at the time, they might give us or be unable to give us answers when we try and do an assessment. Be unable to or give us very different answers than what they would after they're sober. Yep, go ahead and add to that.
So medical clearance serves several different purposes. One, yes, we need to know if something's in their system. Not only because we need to be, so law says when we assess someone in crisis that they need to be able to be mentally sound in order to make decisions for themselves. If they are, because of mental health, not able to, then we would be looking at those detention options. If they are just simply under the influence and need to maybe sober up, we will wait that out. However, there are certain medical conditions that can mimic mental health conditions. So we're looking for those. We're also looking to see what is in their system. And one of the big things is the EKG, so the heart. There are certain psychotropic medications that can not only counteract with different things that can be inside the body that they may have put there, but also can affect the heart. So is the person's heart healthy enough to be able to do some of these psychotropic medications? That all has to be done before they get to the hospital, simply because many times psychiatric hospitals don't have the ability to do those things on their own.
What happens when these people come through the emergency room and they're out of their mind? Do you get called right away? Who decides that?
The medical staff would decide when we're called.
Okay.
So it can be different, and it can be different by county. So sometimes we'll get a call saying, hey, FYI, I got John Doe in here. His blood alcohol is about 342, very suicidal. Just wanted to know let you know he's here.
Okay.
Other times we'll get a call that says, hey, John Doe has been here for about 12 hours now, medically cleared. You want to assess?
Yeah,
So-
yeah. So in those
It really
situations,
is
we know that it's coming, but it might be the following shift that ends up doing the assessment because we're waiting for substances to get out of their system.
Yes, must be very busy.
Depends on the day. I think that is one of the interesting things about it. Every time you pick up the phone, you really don't know what is on the other end of the line. But it keeps things interesting for sure. So youth justice, what I do with Youth for Christ works alongside of students who are in the youth justice area. So some basic things about youth justice. When incidents happen, we don't automatically, so like Joanne mentioned before, a kid gets caught with a vape doesn't automatically mean that they're getting arrested and that they're going to jail. I know we like to joke about that, but that's not what actually happens. In fact, having worked in a juvenile justice center for the last 12 years, I can tell you that, again, kind of like other hospitalization, that's the last resort. That is not where we want to put people automatically. So youth justice is going to work on all sorts of different ways to keep a person at home, to keep a youth in the place where they thrive the most. So law enforcement determines the relevant charges and sends a referral to the Department of Human Services and Youth Justice. They're reviewed and assigned to a youth justice social worker. There's an intake meeting with them. Recommendations are made either to petition the charge I mean, that's one of the options. Enter into an informal agreement or counsel the case and close.
The reason we added this youth justice piece is this is sometimes the avenue that kids are able to get some help,
Sure.
especially related
Sure.
to substance use. So we thought that this was an important piece, even though we don't want kids involved with youth justice. It
Yeah.
sometimes is the avenue that we can get them some help.
And it's sad because sometimes there's this gap, you know, like someone hasn't gotten in trouble enough to get services, but they're still obviously making poor choices. And unfortunately, either it's only a matter of time or, so sometimes there can be like, kid is doing fine, kid hasn't done anything bad enough to warrant something. That middle space can be a very difficult place for parents to be. So community resources, referrals to community resources that can happen, mental health therapy, substance use counseling, monitoring and mentoring, or educational services. We know, and I know from working with students from the last 12 years that, there is a lot more that goes into, for lack of a better term, bad behavior than just simply, I just want to ruin my life today. There's a lot of trauma that goes on. There's a lot of situations at home, a lot of substance abuse that could potentially be going on, a lot of impulsiveness related to mental health. So there's a variety of different things. So if we can address some of those things, we might prevent them from having further being further engaged in the youth justice system itself and prevent them from going further into the correction system as well. So specialized programs, adolescent diversion programs, and other county programs. And I mentioned before, I work for Youth for Christ, and we have a variety of ministries, but one of the ones that we do is juvenile justice, and have for, I think, about 40 plus years. YFC has been involved in that. And we have kind of a spectrum. We realize that, like I said before, there's a variety of different reasons why students are involved in the juvenile justice system. And we realize that that's a really difficult place for them to be and also for their families to be. So we want to walk alongside them as much as possible. So, looking at it kind of on a scale of the programming that we do, corrections being the most restrictive. I'm in the Portage County Juvenile Detention Center doing programming with students there twice a week. One day is kind of loosely faith-based. Another day is a life skills class where we're contracted with the Stevens Point School District to do that. However, we do have students coming from Wood County. We have students coming from all sorts of different counties. There's 13 detention centers in Wisconsin, but there's 72 counties. So we've got kids coming from a variety of different areas into this facility. Typically, they're 3 days to 3 months, but usually in some of the most difficult circumstances of their life. How did we get here? Where I'm arrested, I don't know what's happening next, so on and so forth. We also do dinner and discussions at Positive Alternatives Group Home. I was just there last night bringing them some Jimmy John's and talking about mental health month. And then one thing that we started this past year is we're doing a life choices class at Lincoln High School and adding the alternative school or River Cities High School in the fall. So what we're doing there is we're working with kids who are just kind of on the fringes of the youth justice system. They haven't been incarcerated yet, but they might have gotten a couple referrals or something like that. And so now we want to keep them out of the system. We want to keep them from getting into those higher, more restrictive settings. And so we're walking alongside of them in a weekly class and encouraging them. We have 4 students that are graduating in an honor celebration on Thursday, which I'm super excited about. They want Starbucks, so that's what we're going to do for it. But it's been really neat this year walking alongside of students and getting to know them on a different level through those classes. And then we also have an aftercare piece that we do too. We meet with students in downtown Stevens Point who have already been in the juvenile justice system, and now we're walking alongside them afterwards. So substance use specific resources. I'll let you take that from there.
So I added some stuff about substance use specific resources simply because, as I mentioned earlier, there's sort of a gap in youth services in Wood County in general, but particularly in Marshfield. some of the
Why is
places
that?
that we have.
Why is that?
Why? Well, it has to do with the licensing that's needed for. It's not the same license to be an adult substance use counselor as it is for a youth, and so in the laws changed. So individual counselors, it used to be that they could get a license and practice within any practice, and now the practice has to have an overall license for substance abuse counseling. And that makes it just difficult for agencies to do that. And many of them have chose not to do that. And so then it's really easy. Plus, there's just a lack of counselors that work with youth.
What do you do with the youth that the parents are the abusers of substance and they're falling into like I was shoveling snow one day.
Yeah.
And I'm taking us back before COVID.
Yeah.
And this generally, it's dark because it's winter, 7:00 at night. And this guy stops by and he says, "What are you doing tonight?" And I said, "Oh, I'm just shoveling. I'm going to watch some movies." And he says, "Aren't you going to go out and get high?" I said, "I don't do that." He says, "Everybody does that. My mom does it. My dad does it. They have their friends over. That's what they're doing right now. That's why I'm out for a walk." And I thought,
How old is that person? About
he's senior in high school, maybe
Sure,
a
a
junior,
teenager.
but his parents are getting high at home.
Yes.
So
And when we look at substance use for kids, the most place
He
that
wants
kids
to
get
be
substance use
clean.
is from their family.
he wants to be clean.
Yeah.
So where can you go in Marshfield?
Back on the table, it says AOTA resources, and it lists all the Alateen, Al-Anon, all of the different support services. But I will tell you, the place that they need to go is their school counselor. To go to someone who they're with a lot, to do problem solving, to talk things through. That would also be, if they're distressed, a call to crisis might be something that they do as well. The problem is, you can't make somebody do something. A youth cannot make their parents stop using. The idea then would be, how do we build supports around the youth outside of their family and their parents? So mentoring programs, again, being involved with school. So we find kids who are more involved with school and school activities are more protected from both mental health and substance use. So if they're in a sport, if they're in if they're in drama or some after school program. So how do you build supports and other adults around this student? Sometimes it's a faith-based thing. So the kid starts going to a youth group, and then he or she gets supports that way, because, I say this frequently, you can lead a horse to water, but you can't make them drink, right? So you can't make someone get substance use therapy if they don't want it. You can't make them quit. It's the same with mental health therapy. Someone has to be invested. Now, are there ways to encourage it? Absolutely there are, because as you build relationships with people, then the more they feel connected and the more they want to get some help. So it would be complicated, but you have to figure out who's already connected with this kid. How do you build those? And then how do you maybe work on some other things? Social workers frequently use what we call systems theory, right? So you have a person, and there's all sorts of systems around them. And the idea is, if you poke at any one system, there's a ripple effect that changes a lot of different things. So you don't have to always work directly on the one thing that you want. You want the parents to stop using, but maybe where you have to poke is building the kid's relationship with grandparents or an uncle, an aunt, or, someone in their church or a particular teacher. And that makes some changes, not just with the kid, but within the whole system.
I've been part of Al-Anon for years.
Yeah.
And where I'm coming with the youth is, I was the sober one, and my daughter was not brought to me because she believed her father's lies, because the abuser is so incredibly
Yes.
manipulative.
Yeah. There's some additional resources having to do with that. So let me finish this slide, and then I'm going to get to that next one too. Okay. So one of the things that I wanted to make sure we talk about is that it's often difficult to tell where mental health starts and where substance use starts, and they're frequently intertwined. So sometimes, even though we do not have substance use services, we have mental health services, and maybe that is a place to start, because then those underlying issues. Of course, the difficulty is, and we've run into this, you can't do therapy if somebody's high. You have to have them, sober and with you to do therapy. But at the same time, that could, again, make some changes in that life to be able to address the substance use issues as well, even though it's not direct substance use therapy. They're very intertwined. So you always have to look at mental health issues, and we do have mental health services. So that's one. I did mention there's limited treatment services. I'm super hopeful. ODC, which is most people know the Opportunity Development Center. Is that it, right? They have opened a mental health clinic in Rapids and in Point called Opportunities for Hope, and they're expanding. We're hoping to get some services in Marshfield, and they are an agency that's dual certified for substance use and for mental health for youth and adults. So we're hoping to expand some of those services here. They just hired 2 new therapists. So we're hoping to at least get someone to come into our schools 1 or 2 days a week to do any therapy that needs to happen at school. So there's many community members, and Macy in particular, that are working on how do we get more services into Marshfield. And again, services are voluntary. I think I've said enough about that so that you know that. I did include a sheet. One of the big things we see with kids now and adults is vaping. Nicotine is highly addictive. And in a vape, the amount of nicotine is significantly more than in a traditional cigarette. And people, not just kids, but kids and people, adults, don't recognize the amount of nicotine that they are taking into their body and become dependent on that very quickly.
Are you saying that the vaping has more?
Yes, the vape pods have way more nicotine.
Okay.
The vapes are not regulated, which means they can write anything on the label that they want to. And studies have found that the labels are usually not consistent with the contents. So there's some vapes that say nicotine free that are not nicotine free. Some say they have a lot of nicotine and they have less. Some say they have less and there's a lot. There's no regulation of it. So they can put whatever they want in there. And that high addictive nature, really, then we have young kids whose brain is developing, who are now addicted to nicotine. It really impacts the pleasure centers of their brain and really impacts their mental health. So vaping has now been linked to anxiety and depression in youth and in adults. And so we really need to be looking at that. So I did include some ways to quit and some interventions that happen. At the School District of Marshfield, we use the In-Depth program as our first diversion program. It's an educational program that we provide for students if they get caught vaping to keep them again out of the court system. But there's a lot of other ways that if a kid were motivated to quit, In-Depth is not a cessation program. It is an educational program, but there are some cessation programs, and that's very worthwhile for people to pursue. And there are some other helpful programs. So in terms of what you're talking about, relationships and abusive relationships, the Personal Development Center is here in town. It is our domestic violence center here in Marshfield, but they deal with domestic violence and sexual assault. So, and they come into our schools as needed. They do some presentations for our schools, but they will also see kids if a counselor says, hey, I have this situation. It's not mental health, it's this relationship issue, and there's been some violence. Can you come? And the advocates will come and meet with our students as well. So sometimes a mental health therapist isn't the first step, but maybe an advocate and support through Personal Development Center is the more appropriate thing. And then maybe mental health stuff happens later, maybe not at all. It just sort of depends on the situation. But it's another resource that we have in the schools, but it's in our community. The number that's on there is a 24/7 number, so you can call and talk to someone about domestic issues, how to problem solve, and they can advocate and as Liz says, walk alongside you to get services that you need. Okay. And then I put Katie Beckett on here because Katie Beckett is one of those programs that not everybody knows about, but it's a really important program. And Katie Beckett essentially is a different application process to get Medicaid in our state. And So if a family has regular insurance and has an income and has employer-based insurance, but there's still a lot of costs that go with someone who has physical or mental health issues. And it would be helpful if they were on Medicaid, especially because then programs like CCS and the waiver program, you can then access those programs. But families find it helpful, especially if there's frequent hospitalizations or lots of medication, things that maybe an insurance doesn't pay for. You have this really high deductible. Katie Beckett's a really good option. So it essentially doesn't look just at income. It looks at, do they meet a criteria that they need some Medicaid, and it ends up being a supplemental insurance to other insurances that the family might have. Do you guys have anything else about Katie Beckett that
No,
would make sense?
I think what you said was fine. I think just knowing that it's like there is no income eligibility, like typical Medicaid services, there is an income eligibility where Katie Beckett is for children with high or special needs is what they call it.
I haven't heard of it.
Yeah, lots of people haven't heard of it, but it's super helpful for families who are expending a lot of income to meet the needs of their kids. And so this is a way to be able to get that supplemental insurance.
Also, I guess, I feel like the threshold to meet that special needs isn't incredibly hard. Like, I feel like if you have a kiddo who's sort of struggling, just apply, and you're feeling like you're kind of being bogged down by medical bills or costs, then I would certainly encourage anyone to apply. They will do a functional eligibility and then determine whether the child is special needs or not.
Yeah, and I didn't put on here their Social Security disability. Kids are eligible for that. So
I got one more thing on Katie Beckett.
yes,
They are a little different, and there is a wait for that program. So right now, if you were to call today, you may not even find out if your child is eligible for about 2 to 3 months.
But it does backdate.
It does backdate.
Yes.
It backdates to the date that you make the initial call.
yes,
And
excellent.
sometimes previous to that, depending upon the child's situation.
Yes. So it can be a really good support for families. I didn't put SSI or SSD on here. Youth can apply, or families can apply for youth with disabilities. But as Georgette said, the bar is really whichever. It's high. It's hard to qualify. It's hard to qualify for, yes. Katie Beckett's much easier to qualify for.
In terms of functional eligibility.
Exactly.
Their eligibility requirements are just different.
They're very different. You're more likely to be able to get some sort of Social Security if it's an intellectual disability that's involved with the situation. So, and then in the little green box, I also put on the School District of Marshfield's website, we have a link. It's there, but you can find it by hitting, on the home page. You hit families. Anybody, you don't have to be a family to do it. Families, and then student services, and then community resources. Then we have a list of all the different community resources. We have AOTA resources, mental health resources, grief resources, food resources, financial resources, transportation resources, housing resources, almost anything that you can think of that somebody might need. They're very specific to Marshfield, so you're not going to see a lot of resources in Rapids or Point. You're going to see Marshfield things, so they're meant to be user-friendly, hands-on. This is what these are the easy places to call and get services. So those are available to you. You can also, again, talk to your student services staff at the school that your youth goes to, and they can help lead you to the right resources as well. Okay. All right. Are there any questions for any of the panel?
I was wondering what you think about getting marijuana legal.
So there are a lot of, so I will tell you, this is very controversial, and there's positives and negatives on all the sides. I work with a lot of prevention experts, the health department and many other prevention experts. That's part of what Macy does, is prevention having to do with substance use. And there are a couple schools of thought. Right now in Wisconsin, our drug source is really unreliable. It's very dangerous. There is a lot that's contaminating our drug source. And some people believe, even in prevention, that legalization of marijuana will help regulate that and make our drug source more stable and less dangerous. Do I know which is the right thing? I don't know. But we are surrounded by legal states. And so things creep into our state regardless, and we have no control over it. So there's arguments on both sides having to do with the legalization of marijuana. We did, Macy and the health department have passed laws or ordinances to make it so youth cannot buy even the
Delta 8.
the Delta 8 products. There's Delta products, which are synthetic marijuana products that are still hallucinogenic. And you can buy those. There's Delta 8 stores in Marshall. You can go in and buy stuff. And
Yeah.
youth used to be able to go in and buy stuff directly, even though we don't have marijuana
We
legal
have no idea
here.
what's in it then.
Correct.
And it looks, a lot of the products look very similar to regular candy
Yes.
too. I went in.
Yep.
Candy?
And
Candies, yes.
Candy, yeah. I
Yes.
was part of the city council meeting where we addressed this, and a lot of them, you know, they look like nerd ropes or like other types of
Mhm.
candy and stuff. And these are things that I saw along, like in shops along Central. You know, I didn't have to go too far out to do this. I saw these things, I took pictures of them, and as I'm scanning through my phone, my kids are like, "That's candy." I was like, "No, it's not."
And so
So-
now there's an
Somebody
ordinance in
tells them it's candy, probably.
Yeah.
there's an ordinance in Marshall that they cannot sell to 21 and younger, right? Is it
Mhm.
21
And
or,
I think they
or
have to be
younger than 21?
a certain distance away from.
And you have to be a
school
certain,
or-
the business has to be a certain
Business.
number of yards away from schools
Mhm.
or youth-oriented businesses, kind of thing. And, you know, the good thing is we just did a community scan and all of the vape shops passed. They did not sell to young kids. So they're at least paying attention to that ordinance and are complying with it, which is good news. However, if their parents buy something and it's at their house,
It's
That-
hard to
that-
tell the difference.
it's hard to tell
sometimes.
the difference. And there's THC vapes, you know, that you can get THC for the vapes. You can get things online. So that there is, I mean, legalization or not, marijuana in particular and THC products are readily available.
It's good to have the facts.
Mhm.
What always, when the hardest part that I have found, like being with Al-Anon or knowing people that use pot through, I have a brother that has used pot.
Mhm.
He graduated in 1972 and he's always used pot since he's graduated. And the way, when you speak to people in general, they either deny, no, this isn't happening, no, this stuff isn't there. We get people that do that, like, let's just be in our bubble and pretend this isn't happening. Or if you say something, then they're afraid to be around you and they'll go, oh, she's got a mental health issue, which I technically don't. I'm on the other side, I want to help.
Mhm.
Come on, it doesn't help when you put up these denials.
Yeah, there's still a lot of stigma related to both mental health and substance use. You know, I know that Liz does a lot of work with juvenile justice in trying to make people realize that these are people, right?
Correct.
To humanize. And I think we need to do the same thing with substance use. It's not that somebody is evil. They have a substance use disorder perhaps, but they're still human and they're dealing with things. And how can we help them? How can we help them get past this? As opposed to just being punitive, because that has not been something that has worked. But there's also a lot of stigma related to mental health in that, oh, those are those people. And and really what helps everybody is when you take people in and when we all work together. And that's really what's needed, is just to find services and to help people as opposed to ostracize them.
Why has Alateen never been successful here?
That's a very good question. I don't know the answer to that.
Alcohol is addicting, yes.
Well, this community is German and we like our beer.
Yeah.
For so number one, Dad, and people like to drink and it's legal. And I get that, it's part of the culture. But they're the ones that put the stigma there and then.
Yeah, there is a huge cultural issue around alcohol in Wisconsin.
Drink Wisconsinably.
Yeah, and I work with some people. We just Macy just wrote a very large grant to try and do some more prevention work around substance use. And when we look at some of the numbers we have, say our youth risk behavior survey, our numbers are very high, have to do with alcohol use, but it's rarely seen as our biggest problem because it's a normal problem in Wisconsin. The amount that kids drink is pretty typical. So nobody sees that as, oh my gosh, what should we be doing about that? But if you compare Wisconsin numbers to other states that are non-drinking states, there's a couple other states that rival us in terms of that. But where drinking is not quite the same culture, then our numbers look astounding.
Right. And then you can't reach the teen because the teen is trying to live with mom and dad who drink.
Well, our laws are that a parent can buy their own child alcohol, and drink with them in the bar. That's what the laws in Wisconsin are. I'm not saying it's right or wrong. That's just the culture that we live in.
Well, I think it's wonderful that you into the schools because if they aren't getting it at home, at least they're going to get something at school.
Yes.
That's solid.
If somebody doesn't stigmatize them in school.
Right.
Teacher,
There are still issues of stigma no matter where you are, and that includes in school. We're working really hard on that, but just like with the culture, there are issues, and it's a constant battle. And
I wish I could just be a little more and sneak around and go. And they don't even know it. Nobody would know it.
Yeah.
And I can talk to these kids and go, okay, it's okay. I had aunts that were alcoholics, and my dad begged me not to drink because he knew I could possibly have a
Sure.
disposition.
Sure.
But not everybody has that there.
Right. Yeah. And
But
we're
I
really,
think what you're mentioning in that is a supportive adult in a
Right.
kid's life,
Mhm.
and that's
Right.
one thing that is desperately missing in a lot of.
Can I come forward
youth.
and help? Can I volunteer?
you
I'm always
absolutely,
looking for volunteers.
yeah,
Let's talk
there's
sometime.
many opportunities for
Okay.
volunteering.
Yeah.
So absolutely, yes, you
I
should
wish
consider
somebody would have
about
been
that.
there for my-
Yeah.
I'll help. No.
Excellent.
Come on and sit down.
Excellent. Any other questions that anybody has? All right, I don't see a lot of rain yet, so we're going to let you go and beat the storm home.